session. Welcome to everyone, and thank you for joining us today. My name is Stephen from the University of Southern California, Leonard Davis School of Gerontology. Today's session will be navigating nutrition careers, the CDM versus the registered dietitian. Today, we are joined by Laura Kaufman, who is the clinical preceptor and internship coordinator for the coordinated program in nutrition and dietetics at USC. Kaufman earned her bachelor's degree in psychology from the University of Colorado Boulder, then went on to earn her MS in nutrition, health span, and longevity from USC in 2020. She worked as a clinical dietitian and outpatient clinical dietitian at USC hospitals. She was also a registered dietitian at Shield Healthcare. Today, she will be helping navigate our careers within nutrition and dietetics and explain more about how our 4 different programs can prepare you for different career paths. Our 4 programs focus and prepare students for these 2 different licensures. The Master of Arts in Food Service Management and Dietetics, along with the Master of Science in Lifespan Nutrition and Dietetics, will prepare students for the CDM. Students that complete the Master of Science in Nutrition, Health Span, and Longevity program, or the Master of Science in Nutritional Science, could potentially pursue careers as RDNs. With that said, I would like to turn it over to Laura.
Thanks, Stephen. So my name is Laura. And so overall today, the biggest things that we're really going to focus on are talking about the difference between the RDN and CDM credential. And then we're also going to dive into both and look at what specific career opportunities would be available within each of these kind of pathways. And so we'll start off with a registered dietitian or a registered dietitian nutritionist. So RDs are considered the food and nutrition experts. They really translate the science of nutrition into solutions for living and really try to work closely with individuals and help to promote sustainable lifestyle changes. They are qualified to manage nutrition therapy of individuals with both acute and chronic illnesses. RDs can be employed in a wide variety of settings: hospitals, outpatient clinics, research institutions, and many more. And so one thing I will say that sort of separates the registered dietitian from an individual using the title of nutritionist is really what we're going to talk about today, that the RDN credential is backed by an accrediting body. There are clear requirements that have been met by someone that carries this credential, which differs from nutritionist, which does not have any specific kind of experience or qualifications needed in order to use that title. Next slide. And so for registered dietitians, the Academy of Nutrition and Dietetics is our association, or kind of the largest body. It represents over 112,000 credentialed practitioners. So this would make up registered dietitians, students, as well as diet techs. And then Ascend is the agency through which institutions would receive and maintain accreditation. And so our program here at USC, our MS in Nutrition, Health Span, and Longevity, received its accreditation back in 2018. Next slide. And so this is the only program at USC that is accredited by Ascend, and that this in itself would prepare someone to sit for the RD exam. You become eligible to sit for this once you have obtained a degree from an accredited institution, as well as completed 1,000 hours of supervised practice rotations. And this type of credential does also have a continuing education component once you do obtain the credential in order to maintain it. Next slide. And so coming up next year, there is a change happening with the minimum degree requirement in order to sit for the exam. Whereas in the past, it's been a bachelor's degree starting in January of 2024, that will change to a master's degree. And so those who are already dietitians are not required to then go obtain their master's degree if they have a bachelor's, but we do have one program option here, our MS Nutritional Science, that could be an opportunity for those students who either are already a dietitian and are looking to get their master's, or individuals who have completed their DPD coursework at the bachelor's level and now looking to obtain their master's. Slide. And so now hopping into some career options, one major career option in terms of being a registered dietitian would be focusing on the clinical aspect. This could be inpatient, it could be outpatient. And so in the inpatient facility, we have hospitals, rehabs, skilled nursing facilities, even correctional facilities. And so working in this type of setting as a dietitian, you could sit on the more clinical side as a dietitian or a manager, where you are having that direct patient care, doing assessments and providing recommendations. Or you could work more on the food service side. And we're going to talk a little bit more about the food service opportunities once we get into the CDM. But having your RDN does automatically qualify you for these types of roles as well. Any jobs that would want a CDM, you are qualified as a registered dietitian. And so in this, some examples of places our alumni have worked after graduating from our program as a dietitian. We've had several go into inpatient. We've had some work at Hoag Hospital, Children's Hospital, and All of You Medical Center, just to name a few. Moving on to outpatient. So whereas inpatient, you are working with the patients that are actually admitted into the hospital, outpatient side is more patients coming in from their home into the clinic and having an appointment with you. And so this is also very focused on direct care with patients. This could be somewhere more of a general practice where you would meet with patients for a wide variety of reasons or medical conditions. And as you can see, there's also a lot of really niche areas where you could specialize and practice there. After obtaining your RDN, there are lots of opportunities if you are interested in actually obtaining additional credentials to even further elevate your kind of practice in these areas. And some examples would be in diabetes, in kidney disease, in nutrition support. So patients that are needing alternative means of nutrition, weight management, just to kind of provide a few examples there. On the outpatient side, we have a lot of alumni who have also gone into work in outpatient clinics. Some specific examples, we've had the USC Abdominal Organ Transplant Clinic, as well as dialysis clinics like DaVita and Fresenius. And so Stephen mentioned a little bit about my kind of job history before taking on the role I currently have now. I worked as an inpatient dietitian with USC Verdugo Hills Hospital, as well as an outpatient dietitian with Keck Medicine, where what was a general practice. And so that was an opportunity to see really a wide variety of conditions that a doctor was referring for. And that I also worked in a metabolic clinic where I worked with individuals with inborn error of metabolism. So just two examples there that of a really niche specific side and then really general. And so the next couple of slides, I'll walk you through kind of what a typical day may have looked like for me in each of those settings. Next slide. So starting with the inpatient side. So each day tends to follow a similar pattern. The first thing I would do when I came in the morning was screen the patients. And so what that involves is taking a look at all of the patients who have been admitted since the previous day. And so we're looking at things like reason for admission, any patients that we specifically received a consult from the doctor, or any other triggers that kind of identify a nutrition intervention may be indicated. And you use that with the hospital policy and are basically assigning dates to when each patient will be assessed by a dietitian. And then after that, you have your list. And I would basically go through the medical chart for each patient, gathering pertinent information, kind of getting an idea of what was going on and why they were in the hospital. Then the next thing I would do is go to rounds, which is really meeting with the rest of the medical team at the hospital. That could include the doctors, speech therapy, case managers, pharmacy. So really the opportunity to hear in real time what's going on with the patient, discharge planning. Also my opportunity if there were certain recommendations or questions that I hadn't been able to get in touch with the doctor about the day before, you're kind of with the whole team at that point. Then after rounds, you go see all your patients. And so you're getting an idea of how they've been eating since they've been in the hospital. How are they eating at home? Have they had weight loss? Really everything that we need to know, and what kind of working with them and what we might want to change in order to maximize their nutritional status while they're in the hospital. Connecting with nurses, speech therapy, family, even sometimes to fill in any gaps for information. And then the rest of the day is really all of your documentation. So you're going back to your office, you're going into the medical record and writing down everything that you found, all of your recommendations, and then connecting with the doctor to discuss your recommendations. And so on the inpatient side, you can see a lot of time is spent sort of in the chart, and maximizing the nutrition status is kind of a big goal on the inpatient side. Next slide. So we'll kind of now contrast this with what a day might look like if you were working as an outpatient dietitian in a clinic. In terms of this structure, it's kind of exactly the opposite. Most of your time is spent face-to-face with your patient or your client. And so the first thing in the morning, you're kind of getting an idea of what your schedule is. Who are you going to see today? Looking through their charts and pulling some key information. And then the majority of the morning is actually spent with patients during these appointments. And so you're really learning about what are their goals, what are their concerns. It's much more patient-centered, and providing education and nutrition counseling. Sort of in between appointments, you're doing charting. If someone doesn't show up or you finish early, you're responding to emails, and then you're hopping back on the next appointment. Lunch, kind of get this hour break, at least I did in my practice. So eating as well as really just catching up on emails and charting from the morning. Afternoon kind of mimics that same pattern, have appointments, initials, follow-ups, and then at the end of the day, you're wrapping everything up. Might take a look at the next day's schedule and then use the message center to communicate out any recommendations that I have to the referring physician. Next slide. So getting back onto career opportunities, some additional areas that you could specialize if interested are working with individuals with eating disorders. This could be in an outpatient center or an inpatient facility. We have an alumni who worked at Monte Nido inpatient facility, as well as Nourished with Kindness on the outpatient side. Sports nutrition is another really popular area that we have a lot of students who are interested in. You're really able to work directly with the athletes. This could be at the collegiate or the professional level. We've had alumni go on to work with USC Athletics here, as well as University of Texas, the Anaheim Ducks, and LA Galaxy. Another option would be getting into corporate wellness. And so this is interesting and kind of brings in aspects of food psychology. How are we presenting food to the employees, food meals and snacks to kind of help them make positive choices, coming up with new recipes, different activities or resources, really just to promote health and wellness in the workplace. And we have one alumni who works as the dietitian with Riot Games. Next slide. Okay. More opportunities. So in terms of food service on the non-healthcare side, we also have options if you're not really interested on that patient side. The meal delivery, meal planning companies are so popular right now. This is an area where you could be involved with recipe development, nutrient analysis. A lot of companies even tailor their meals to individuals with chronic diseases. So even can kind of tie in that clinical aspect without actually being in the hospital. School nutrition is another opportunity. This could be as a food service director. It could be working as a dietitian in the student health center, working with the students. It could be in the dining halls, working with dining services and on all of the meals that are served in the dining halls. Then we have community and all sorts of different public health settings. Head Start, as an example, is geared toward healthy nutrition for children. We have WIC, which is for nutritionally at-risk women, infants, and children. School districts may also have a wellness director that's maybe in charge of just promoting healthy foods and education with students or their families. So a lot of nonprofits out there that are involved with food distribution or even Meals on Wheels. Next slide. Another option, if interested, would be opening up your own private practice. We've had some students who have even done this right away after graduating, or being more involved on the kind of social media side, getting your kind of ideas and research that you have done and sort of recommendations out there that way. We also have 2 alumni who started their own RD exam prep company together. In terms of education, having your master's degree would give you the opportunity of teaching. So you could always teach a nutrition class at a community college, for example. And then I also myself, as another option, have come back on the kind of administrative education side, where I help to work on all of the placements for our students for internships. And then I also work as a clinical preceptor with some of the students in their hospital rotations. Lastly, we have research. We've had alumni work in areas such as Alzheimer's, weight management, fasting and cancer, and substance abuse recovery. So as you can see, obtaining that RDN credential gives you a lot of different opportunities. I don't think I've even covered all of them today, but kind of shows you all the different facets and variety that you could pursue. Next slide. So switching gears to the certified dietary manager. And so whereas the RD is more the food and nutrition expert, the CDM is really that expert at managing all of the food service operations and ensuring food safety. And so they will have their hands in a lot of different elements within the food service production, implementing, updating menus, would be in charge of purchasing and overseeing everything related to food prep. They may also work with some nutrition in a more kind of basic manner. And so this CDM credential is the primary qualification for a director of food and nutrition services in the absence of a dietitian. Like I mentioned, a dietitian or an RD would be qualified for that position as well. And so like the RDN, the CDM has specific competencies that you are required to meet in order to be able to take the exam. And so these areas are nutrition, food service, personnel and communications, sanitation and safety, and business operations. Next slide. So for the CDM, their association is the Association of Nutrition and Food Service Professionals. And then the certifying board is the certifying board for dietary managers. And so the 2 programs that we have here that are sort of geared toward being able to take this exam if you were interested are our MA in Food Service Management and Dietetics, as well as the MS in Lifespan Nutrition and Dietetics. Both of these kind of follow the coursework that would prepare you for that. They have a classwork and an internship component. Next slide. And so for the CDM, there are a variety of different pathways you could actually take to become qualified to take the exam. So there are 5 pathways. And so our program qualifies students through this second pathway, providing a master's degree. Similar to the dietitian, there is continuing education requirement in order to maintain the CDM credential. Next slide. So getting into some career opportunities on this more food service, dietary manager side, I'm going to start off with some possible job titles, and then we'll kind of look at some possible locations where you might work. So having this certification really qualifies you to work at that highest level within food service, which would be the directorial level. At that level, you are really overseeing all of the food service operations. And so depending on the size of the kitchen, that would dictate how many people you're overseeing, but that would include food service workers, any supervisors, as well as managers. And so as you can see here, listed out some possible wording that you might see, that sometimes it's food service director or director of food service. You could certainly be a dietary manager, director of culinary services, could work in the hospitality or hotel industry, could even own your own restaurant if you were interested. Next slide. So now we have some possible job sites, also very wide scale in terms of the places that you could work. Again, we have healthcare, like a skilled nursing facility or a hospital, also senior living facilities that would include assisted or independent living, food service operations at universities or with school districts, large-scale sporting arenas, stadiums, as well as athletics. Having that sort of nutrition component that's part of the CDM, you could still work with athletes alongside a dietitian, since you can practice that kind of basic nutrition. Basically, anywhere where food is distributed is going to have food service management and could be a possible opportunity for you. Next slide. So here we have some sample companies. So Sodexo, Compass, and Aramark are all large contract food service companies. And so often they actually employ the food service staff and nutrition staff that work in a hospital. They would also service education, government, and sports industries as well. Morrison is another contract food service company in the healthcare industry. These contract companies like to hire CDMs. They're a little bit more, I would say, of a known commodity. They know the training that is required to obtain your CDM. These companies know that there is also a continuing education component. So they know that you're going to be always learning and keeping up with the latest. And they also know that you can do basic nutrition. Some other options on here, we have the VA hospital, and then we have Levy Restaurants, which is an interesting one. They do the food service for a lot of different professional sports arenas, collegiate sports, even resorts, museums, golf tournaments, lots of different opportunities there. Next slide. So in terms of job duties of a CDM, there's a lot of different tasks that they could be responsible for. It's really everything that kind of goes on before, during, after, as it relates to food and meals. So the CDM or food service director would develop the budgets for planning meals, utilize food waste and inventory to guide purchasing, manage the staff to ensure safety and sanitation. And that would apply both to food safety as well as just safe practices to prevent injury. Would oversee staffing, hiring, onboarding, ongoing education to the staff, interact with residents, getting feedback, providing service recovery anywhere where there may be an issue. Could also be involved in event planning. And then, like I've mentioned, some basic nutrition screening. So they could do malnutrition screening, track, enter weights in the electronic medical record. They could do some basic nutrition education, and then always refer over to a registered dietitian if there was anything more significant or kind of substantial going on with the patient. And so food service director, someone with the CDM or food service director may not necessarily be the one actively doing all these things, but they are going to be overseeing the people that do. Next slide. And so one of our other internship coordinators here previously worked as a director of dining services with a senior living community. And so I had him kind of put together this day in the life for you guys, since it's not something I could personally speak to. And so I thought this was interesting because it really shows all the different kind of aspects that you could be involved in within this community. And so you would start the day, can you checking in with staff, making sure breakfast was ready to go, greeting residents, obtaining any feedback. Would also meet with a lot of different team members across the community. So that would be the medical team on the skilled nursing side, just getting updates on patient status, other departmental leaders, the chef, dining room manager to plan for the following week, might do some basic nutrition assessments, document in the medical record, and then would finish up the day contacting any vendors for any ordering needs, kind of making sure that that last meal of the day dinner is on track and ready to go as well. Next slide. And so with these roles, these food management roles, a master's degree or a CDM credential may or may not be required, really depending on the job, but it is certainly something that is going to elevate your resume and really depict the level of training and leadership training as well that you have had. And so there was this study done with over 3,500 dietary managers back last year in 2022. And so what they found was that those with the CDM credential and those with a master's or bachelor's degree earned a higher salary. Some other things that contributed to earning a higher salary were supervision. So the more people that they supervised led to a higher salary, but also supervision in general will always be something that will elevate your salary. And it also found that those working in hospitals or retirement communities had a higher salary as well. Next slide. And so one last job opportunity I wanted to touch on is the opportunity of working as a health coach. And so really any of our degree programs could take you on this path if you are interested. This would be, could be separate from obtaining an RDN or a CDM. We offer a health coach class that is an option as an elective for any students that are interested. Having taken this class would then qualify you to become a certified health coach through ACE. And so where this differs from being an RDN is that you're not providing that medical nutrition therapy. You're not working in a clinical facility, but you're really coaching these individuals on how to make positive behavioral changes. And so you're providing support and guidance surrounding nutrition, exercise, sleep, stress, among other things, versus that kind of clinical picture nutrition prescriptions that more of a RDN may provide. I think that is all that I have.
Great. Thank you so much, Laura, for giving us that insight. If you have any questions about any of that information, please feel free to reach out to us or an admission counselor, and we would be more than happy to review your information or any sort of prerequisites for this programs during the application process. I do have some questions prepared for you from our registration. If you do have any questions, please feel free to put them in the chat option as well. But to begin us off with, Laura, can you describe the process for getting certified for the RDN and the CDM?
So the process, so after you would finish your program at USC, we'll say, you will get a certificate. So I know this 100% for the RDN because I went through this. I had to look into it for CDM as well. So basically, once you obtain this certificate, USC also would send your information in to, it's called CDR. And so it would then qualify you to take the exam. And so you're basically just signing up. Take the exam, you go take it. Once you pass the exam, you would then be considered a registered dietitian. And then in order to maintain that credential, you would have to do 75 hours of continuing education every 5-year cycles. And so basically you complete the degree, you take the exam. I believe it is a similar process for the CDM as well, that once you have, like I mentioned, there are those 5 pathways. So our pathway is an option, and then there are pathways that are just a combination of different experience and education. And so I believe it is similar where you would go in and send in like your transcript, show that the way that you have met the qualifications, apply to take the exam, and then take the exam. And then, like I mentioned, there is also a continuing education component to maintain that CDM credential.
Great, thank you for that explanation. So you did mention that you need 1,000 hours for the RDN exam to be eligible to sit for it. Is that true for within every state, or does it vary from state to state?
That is a requirement from a national requirement. So that would be the same across states. So we do have a distance option for this program here. And so even if you live across the country and you're doing the program with us and doing that 1,000 hours, you will still be qualified to sit for the exam. So that's a national requirement.
Great, thank you. With the different career paths that you mentioned for each of the exams, there was kind of what I noticed, an overlay between the two. So is there some kind of overlay, or is it true that some companies will allow a CDM to do what an RDN can do?
So there is some overlay in terms of the nutrition component. So you would still, becoming a CDM, you are still going to have a nutrition component kind of involved. That is one of your competencies. It's not at the same level that you would practice for an RD. There are certain, we have like a scope of practice. And so you would have a scope of practice as a CDM for what types of kind of more basic level nutrition you could do. And then there is the scope of practice that are as an RDN you could practice. And so whereas you couldn't really work as an RDN with the CDM credential, tell me if I lose you here. You could vice versa. So as an RD, you are qualified for a CDM role, but it doesn't work the other way.
Great. So with the RDN, you could open up a private practice, and with the CDM, it's preparing more for the food quality, production, and service.
Yeah,
So
really that management, those managerial roles. Mhm.
could you then open up a private practice with a CDM?
So you wouldn't open up so you could open up a restaurant. And then if you were interested in practicing nutrition after like the MA food service management or MS L&D, I would say the option that you could do in terms of opening a private practice would be doing health coaching, that last option that I mentioned.
Mhm.
And so similar to kind of nutritionist, there's not as specific of a definition behind a health coach, but having taken one of those programs and taking that health coaching class, you could actually become a certified health coach, which again would kind of have that body that is providing that accreditation and that credential to you. So that would sort of be your option for private practice and working with patients without becoming an RD.
Okay, so with the inpatient, outpatient, if a student's interested in clinical work, would they be able to subscribe specific meal plans to students? And if so, do they need the RDN or the CDM for that?
So that would be the RDN. And yes, that is certainly something that you would do in both of those settings, really kind of taking a look at what kind of conditions the patient has. What are we looking at? What goals? Where do we want to go? And so as the RD, you really are developing that nutrition prescription for them, whether it's something that they are consuming orally or whether they have a feeding tube, for example. As the RD, you are still the one, we can't order it, but we would, depending on the state that you're in, here in California, for example, we would make our recommendation to the doctor. This is the prescription that we think this patient should be on. And so some kind of duties and things that we as dietitians are able to do will vary by state. And it will vary kind of whether you obtain a license or whether we are kind of more certified or registered like we are in California.
Thank you for elaborating on those two distinctions. What are some of the expectations of our students that are taking a program that's preparing them for the RDN versus a program for the CDM?
So in terms of expectations, they are both going to have a coursework component and an internship component. The internship component with the RDN is definitely more voluminous. We have more hours and a wider variety of places that you will need to kind of do those hours in. With both, though, we are working a lot with the students in terms of what their interests are. And so an expectation I think that we would want for all our students is to communicate with us. Where are you interested, so that we are doing our best to put you in facilities where you're going to get the most out of it. And so those are kind of the two, I guess, two main kind of facets that we have: the class and internship. I'm not sure if that directly answered your question, though, in terms of expectations.
I think it did. So then to elaborate that on even farther, and you kind of mentioned it earlier, if you have an RDN, you're able to do the capabilities and tasks of a CDM. So if you've only earned a CDM, what purpose would it be to pursue an RDN?
So that would really be if you decide you want to work more heavily on the nutrition side and really be able to recommend specific diets. If you want to work in one of these settings where you would have to be a registered dietitian to work, like a hospital or a clinic. So it would be really if you decided that you wanted to practice that medical nutrition therapy, work with chronic diseases, prevention, treatment on that more clinical level.
Okay, so it sounds like there are two distinctly different career paths for both of the credentials. And in order to sit for the exams, you need to satisfy certain criteria. In order to apply to our programs, our master's programs that make you eligible, what sort of criteria are we looking for?
Yes. So for the coordinated program in nutrition, which is the one that would qualify you to take the RD exam, that has the most substantial prerequisites. It's basically just coursework. There's a pretty extensive list of courses that you would need to have taken if you took them undergrad, or if not, you would take them at, really anywhere that you offer the class, community college, university. I know myself and some other students in my cohort went to like 3 to 5 different schools to do the prerequisites. There would also be to work 40 hours alongside a dietitian for that one. And it's kind of just shadowing. You're really just kind of getting to see a day in the life of a dietitian. And so that is kind of the heaviest prerequisite in terms of that one. Then for the MA food service management, there are no prerequisite requirements in order to enter that program. The Master of Science in Lifespan Nutrition and Dietetics does also have prerequisites, kind of like science coursework, but not to the extent of the nutrition, health span, longevity. And then the Master of Science in Nutritional Science, the prerequisites for that would be having your DPD, which is basically like the undergraduate nutrition kind of program, or already being a registered dietitian and just looking to get that master's.
Great. So can you explain a little bit more around what your job as a preceptor is, internship coordinator, and how that helps our students?
Sure. So I've been in it a whopping 2 months that I will do my best to describe. So on the internship coordinator side, so we it kind of get split. So, you have your classes and we have our internships. And so it varies a little bit for our students that are taking classes or doing the program on campus versus those that are more distance. And so on campus, we are really getting out, building those relationships and kind of contacts with the community, and working with the student to gather their interest, and then working with the site to place the students for their internships. And so it's all of that scheduling. There are also a lot of different assignments that the students will have. The nice thing about our program is that we review all of those assignments versus the preceptors on site. Then for our distance students as the intern coordinator, everything kind of is exactly the same for assignments. And on that level, we kind of sit in a bit more of a supportive role. And so we can provide resources if needed, give you kind of ideas or help prep in terms of finding preceptors, but sort of going out there and actually securing that rotation is falls a little bit more onto the student if they are conducting it as a distance. And so we also coordinate one of our rotations on campus, which is meets professionalization. So we have different speakers that will come in, do different assignments to kind of meet that competency that we do just here on campus at USC. And then on the clinical preceptor side, our community hospital within USC Verdugo Hills, we are very fortunate to be able to send a lot of students to our USC universities. And so for all the students that we send to Verdugo, I actually work there on site with the students. And it's nice because it can kind of offload the clinical dietitians that are there. And so I'm really working with them firsthand on seeing patients, doing assessments, and getting them ready to kind of go out and work on their own.
So it sounds like students have a lot of opportunities, not only to work within USC hospitals, but other companies here in the Southern California region, or if they're abroad, other spaces that they choose as well. Could you describe any sort of assistance for job finding or mentorship opportunities post-graduation?
So post-graduation, so at the beginning of the program, we do connect any incoming students with, well, all the incoming students with a student in the current cohort to kind of be that mentor for you if you have questions. Certainly after graduation, you still have that contact and really anyone else you met here in terms of guidance for suggestions for timing or where to kind of look for jobs. The other nice thing in terms of mentorship, I mean, we are still here. We are always sending out emails for job opportunities that we get from people that we know and from our preceptors. And then your preceptors also are really a kind of forever mentor and resource for you as well. The great thing with here is that because we do send students to lots of different sites, they meet a lot of different dietitians and people within the kind of nutrition field. And so whether that's someone else you're meeting as a fellow intern even, or your preceptor, just the more connections you make and the more opportunities you're able to possibly find after graduation. And then we have our alumni network, which is very large and very robust as an option to always reach out to as well.
Great, wonderful. And you did mention that the requirements for credentials are changing in 2024. Can you talk about some of your predictions for the future in the next 5 to 10 years within the field?
So it is interesting to see. So I think a prediction that we're kind of seeing is that there may be a bit of a delay or a gap in terms of new dietitians entering the field, because now we've added this extra, I mean, 2-3 year, probably 2-year coursework that needs to be completed. And so I think one thing that could certainly be on, I know that I have thought about is where it kind of places our dietitians that are already in the field. And so now we're looking at those that have this wealth of experience, but they don't have that master's degree versus kind of newer students coming into the field that are, of course, new in terms of experience, but now they have that degree. So I think that's one thing that will be interesting to see. And then, like I mentioned, kind of that lag that we might see in terms of new dietitians entering the field, and will we kind of catch up to that?
Thank you for your predictions. And as a graduate of our program, and now that you're here with us, can you describe your favorite memory being at USC?
I've been thinking about that. And as our current students, so we have a course in the coordinated program that is a kind of longevity nutrition course that is actually conducted in Italy. There is an option on campus as well, but you can also go take it in Italy. And our students just actually got back from it. And so it was flooding back all the memories of taking this class in Italy and getting to walk out and go get focaccia bread and go on the weekend to Milan or go to the coast. And so it was really such a fun time to kind of, pair this very challenging and interesting course with getting really close with the cohort. You're kind of all out there experiencing this together, and then getting the opportunity of just being in a foreign country. And so that was one thing that I was very drawn to before the program, knowing that that was an opportunity, and feel very fortunate, and was just a wonderful memory from having done the program.
What a great memory to have. And I know a lot of the other students I talked to that have graduated from the program do share that as well. Laura, thank you so much for your insight into the careers within the realm of nutrition and dietetics, answering all of our questions about what different career paths are available to students and your favorite memory at USC.